Print, email, Facebook, Twitter. More researchers find way to reduce rates of asthma in children by managing condition in expectant mums. Catherine Rosser, who participated in the study, has whizzed through life since she was a child, but was not diagnosed with asthma until she was in her 20s. At first I didn't know what was happening. I thought, am I having panic attack? She said. I felt like perhaps at some point when I'd get it quite badly, I thought I might die. Children whose mothers have asthma are 2 to 3 times more likely to develop the condition themselves, but Ms. Ross's son is asthma-free. They, the researchers, said that his breathing capabilities and his lung capacity and functionality was extremely good, she explained, and that he definitely had no signs of being asthmatic at all. Breath test helps monitor condition when Ms. Rosser was pregnant with her son 10 years ago. She was part of a trial run by the Hunter Medical Research Institute and the University of Newcastle, looking at asthma management during pregnancy. Asthma in pregnancy affects around 10 to 12% of pregnant women in Australia, Vanessa Murphy, one of the study's key researchers from the University of Newcastle, said. And I don't think we take that seriously enough because it can have major impacts on the health of both the mother and the baby. Women who have asthma are known to be at risk of adverse outcomes of pregnancy such as preterm birth and low birth weight. The researchers gave one group a traditional asthma management plan, so expectant mums were medicated based on their symptoms, such as coughing or wheezing. Ms. Rosser was put in the second group. What we tested was a strategy where we measured lung inflammation, using a simple breath test, and we used the results of the breath test to determine how much medication the woman should be using, and we adjusted her medication each month, Dr. Murphy said. What we found was this approach significantly reduced the rate of asthma attacks in pregnancy by half. And what we've done in this study is followed up the children when they were 4 to 6 years old, and looked at how many of them had asthma, and we find again, almost a 50% reduction in doctor-diagnosed asthma in preschool-aged children. The study also found that for those children who did develop asthma, they presented less often to emergency departments for asthma attacks and needed less medication to relieve their symptoms. Findings could have huge implications. Asthma kills 400 people and causes 37,000 hospitalizations a year in Australia alone, with children aged up to 14 being hospitalized at a significantly higher rate. With such stark figures facing the medical world, researchers believe the findings could have profound implications. To see such a clear and robust and impressive effect, I have to say was obviously a nice surprise, said study researcher Jörg Matz, from the John Hunter Children's Hospital. To identify a prevention for asthma is considered to be the holy grail within our research, and this finding, which is unexpectedly very clear and very significant, we believe has large implications because it is the most effective asthma prevention that has been demonstrated so far. The research is published in the Journal of Allergy and Clinical Immunology. Print, email, Facebook, Twitter. More